The nasal bones are the most commonly broken bones in the body. It actually does not take a significant amount of force to break these bones. And so routine activities, even including many sports, or even having an unfortunate accident around the home, can lead to a broken bone. Typically, the symptoms are discomfort. Many times the area around the bridge of the nose will turn black and blue. There is sometimes nasal bleeding associated with this and congestion. Immediate treatment, including ice to the area, keeping the head elevated, and even the use of over-the-counter nasal decongestant sprays for a short period of time, usually no longer than 3 to 5 days, can be used to treat these symptoms. Many times we do not even perform x-rays of a presumed nasal fracture, since the x-ray itself will not necessarily determine whether any treatment is taken. Certainly, however, if there is a loss of consciousness associated with the accident, or if there's any concern that other fractures of the bones of the face could have occurred, medical attention is warranted. The main reasons to address a nasal fracture are either that the portion of the nasal bones and the septum inside the nasal cavity are crooked or deviated enough to cause obstruction, or that the external bones have caused a cosmetic deformity. If either one of these issues have come about, then the choice can be either to do a closed fracture where no incision is made, and usually under mild anesthesia, the fracture is simply reset back into position. On the other hand, many times these abnormalities are not noted immediately, or the decision is to not proceed immediately into a surgical procedure to correct them. Both abnormalities, the nasal obstruction as well as the cosmetic deformity, can then be treated later on in a more formal way to either correct the deviation of the septum or to reset the nasal bones to attain normal cosmetic result.